Hello everyone, this is Dr. Tamer Seckin. We are in Sao Paulo, Brazil, joint meeting of ISGE and Brazilian Endometriosis Society. I have the pleasure of Dr. Chuck Miller here, whose expertise and leadership is known throughout the world endoscopy community. He was the previous president of AAGL, minimally invasive surgery, right? And hi Chuck, how are you?
Tamer, I'm great. I'm in Brazil. How can you be anything but great?
I really want you to give this synopsis of how you're feeling to be in Brazil, in the tone of this whole meeting, and what does it tell you, what kind of inspirations you are feeling towards the future of ISGE with respect to this Brazilian experience. We had a great meeting just minutes ago and you were one of the panelists.
Well, this has been a fantastic meeting. This is my 6th time to have an opportunity to speak to the Brazilian community. And I can tell you that each year, each time I come, I'm able to see the development of minimally invasive surgery in this country takes on just more and more and more. Not only from the standpoint of the surgery itself, but also from a standpoint of the diagnosis. It truly is exciting, and I always say that I learn so much more from coming here than I'm able to give. I also think that it's been a tremendous meeting because it truly has been an international forum. Through the ISGE, we have nearly 20 guests from around the world. So it is both an excitement for the Brazilians having an opportunity to show what they can do and what they're capable of, but also an excitement for us international professors who are able to be involved in this tremendous environment and to give them firsthand some of our experience and knowledge. It truly is what the ISGE should be. It is one of my most favorite conferences from both an academic as well as social experience that I've ever been involved in.
I cannot agree much. We are so much excited. I'd like to focus on the topic though, the endometriosis and the way Maurizio has taken this one step above everything else. I mean, it strikes me with excitement. Department of Endometriosis exists in a university structure. I have never seen this throughout the United States, nowhere else.
Again, I think that I had an opportunity to chair a session today with involving the head of minimally invasive surgery in Melbourne, and Monash, famous Monash, that's Jim Saltis from our board. I was with Charles Chaperone, who is doing research, not only involved in the surgical aspect of research, Tamer, but also involved in beginning of molecular aspects, gene mapping, I mean, truly exciting aspects. And then what Maurizio is involved with actually having a unit that is devoted to endometriosis. All these professors involved in a session, it truly is exciting to someone who has spent much of their life devoted to the treatment of women, both from a standpoint of pregnancy as well as pain with endometriosis. As you know, both of us have lived parallel lives in that respect. To see what is happening out there on an international front is truly makes this for a truly special time.
And the numbers are very clear. So many cases, different surgeons, yet they agree, and we cannot disagree on that. The recurrences are most likely due to incomplete excision. That says a lot for the suffering woman out there.
And it really says a lot for our need to better educate ourselves, to better train ourselves, and to begin to develop these centers of excellence that can be tremendous resource sites for women, so that they're not in situations that they are at greater risk of recurrence because there's been unsatisfactory dissection of the disease in the first place. I actually spoke yesterday on impact of endometriosis on fertility. And you know, I quoted an interesting paper from Italy, from Busacca's group, talking about the fact that first time in with surgery does yield better results overall fertility-wise than subsequent surgeries. So it shows the importance of our patients, and I know you and I both are huge patient advocates. You had the foundation in New York. I've been involved in a very large patient awareness program through the AAGL. I helped to found that for many years. It's very, very important that, and it's a necessity to get our patients to the right place the first time. I'll only add one more comment to that, is that during Professor Brau's talk today, he talked about 20% of his patients having deep endometriosis. And if you look at that, 6 million women potentially in Brazil, 10 million women in the United States, you're talking about over 1.2 million women in Brazil having deep-seated disease. In the United States, at least 2 million women suffering from deep-seated endometriosis. And it's my feeling that what we need to take back from this meeting is that we all have to do it better. We really have to begin to identify who should be treated by generalists, who needs to go to a referral type center.
Yes, we have challenges, great challenges. Young women, infertility patients, pain patients, and deep patients. But in all these challenges, the commonality goes to late diagnosis, misdiagnosis, wrong treatment, and delay. It comes to education and awareness, and it keeps us on the toes to do more.
You know, as people were talking today about delayed diagnosis, that of course we know so well, and it really, it appears in the most recent paper on this that the delay is in the young woman, the teenage woman. One of the things I thought to myself, perhaps this is something that not only will improve because of recognition, we know that this is particularly an age group that we need to be concerned about, but may even be an advantage of, as we get more and more women involved in our specialty, there will be a greater comfort level to see a woman when we're dealing with a teenager. And perhaps a young teen would be more reluctant to see you or me, although I hate to consider that, but the fact is maybe they'll gravitate toward a female and get that diagnosis earlier.
Chuck, now you are the Vice President of ISGE and the coming President. I think you should give some good news to the world endometriosis concerned groups in the world, what ISGE could be doing in your presidency, what we could do, and I'd like to close up with you answering this question.
Well, you know, when I discussed at the board why I thought I was a good candidate to be involved with the ISGE and to subsequently become Vice President and subsequent President, I talked about a couple different areas. I talked about the need for patient awareness. That we are already doing some things in the United States in patient awareness. We have to bring that to our international community. People have to realize that it's not okay to continue month after month after month with menstrual pain, that it's not something that is just a natural phenomena, and it should be potentially checked out. We need to be more aware of centers of excellence. And finally, I ran on a platform of need for physician education as well, to get out to the communities of physicians that endometriosis needs to be treated correctly the first time, because it's the best time, both from a standpoint of pregnancy as well as pelvic pain. And that's what I hope to do, to teach, to teach, to teach. Make patients aware, make physicians aware. That should be our direction in the ISGE.
The first surgery has to be done correctly.
You got it.
Chuck Miller from Chicago, USA.
Thanks,
Chuck.
Tamer. Appreciate it.